how do you navigate this tension between you knowing basically what could be done, but then also really putting the patient in the center and doing what's right for the patient?
This is probably the most difficult thing to navigate. Biggest courageous thing in judgment in clinical dentistry is to know I can do it. It's possible to do it, but it's not the right thing for this patient. No matter how digital, no matter how automated dentistry is going to become, it will always be dependent on the human judgment. And that principle, you just can't break away from that.
So, welcome to Straumann ProTalk. Welcome to the Pulse of Dentistry. My name is George Raber, and today I'm very honored and pleased to welcome Professor Shakeel Shahdad here with us in Basel. Welcome, Shakeel.
Thank you very much, George. It is a great pleasure to be here, and what an honor. Thank you.
So, Shakeel works at the intersection of many different disciplines: restorative dentistry, implantology, periodontics, but he's also very versed in digital. He's working at university, he's working in a private practice in a hospital, and a conversation with him will allow us to have a very holistic view at the state of dentistry today. And today's dentistry is becoming faster, more digital, substituting some of clinicians' decision potentially with AI. But we believe that, managing technology is maybe not the most complex topic to be done right now. It is about clinical judgment. So what to do, what not to do, and when to do the things. And this is exactly what we would like to dive into today with you, Shakeel. So we would like to start with actually learning about your journey, how you built your judgment. Then we'll look at how important and indispensable good clinical judgment is for complex restorative cases. And then last but not least, we would also like to dive into the topic of education. So educating good clinical judgment for the generation to come, which will definitely be active in an era where there is even more digital tools available. So stay tuned. We will learn something today. Now to start, Shakeel, who are you in just 1 minute?
At heart, I am a restorative dentist, and as a restorative dentist, I like looking at the bigger picture.
Mm-hmm.
And I think and this desire to constantly learn, that has been kind of a great, my whole life journey has been about learning things. My passion is to help patients with complex multidisciplinary needs, rehabilitation, is to help youngsters develop that judgment that you talked about. And along the way, if as a teacher, as a trainer, if you can leave your legacy with the next generation, that's the task fulfilled, really. And that's who I am.
So let's dive a little bit into your quite interesting journey, your life journey, and also your professional journey. So you've actually been from very different places. I think you started in Kashmir, then you went further south in India before you came to Europe, I think to Belfast first, then further stations in the UK, so Swansea. Then you went to Dubai,
Yes.
came back to Newcastle, and finally ended up in London, now having, let's say, a dual role in hospital, but also at university, plus you have a private practice. Now, to me, this life journey is not just about, different geographical points. It's really about seeing very different cultures, probably also very different patient needs and patient pools and patient expectations. What I would wonder is, which of those transitions have shaped you most and why?
Well, it's a pretty tricky question to answer because there isn't a simple answer to that question. Like you summed up, it's been a long journey. I was born in Kashmir, spent my early years in Kashmir up to the age of 18, and sitting here in Switzerland, Kashmir, we call it the heaven and earth, or the Switzerland of the East. Yeah. Also, I was born around nature. The mountains, the lakes, the natural beauty and stuff, and you would relate to that sitting here in Switzerland, with these things, with the mountains. they teach you something. They teach you, humility. They teach you
Exactly.
patience. They teach you the scale
Insignificance.
and significance, right? And then getting my dental education in India was a big change for me as well, in terms of moving from a climate which is very similar to Swiss climate into first time experiencing heats of 40, 45 degrees is like, you
It's really
have to,
different. Yeah.
exactly, massive difference, a body shock, shall we
Mhm.
sort of say. Moving to Belfast was something, a big change for me in terms of, learning. Belfast in 1995 was just coming out of their own troubles
Mhm.
that we had in Kashmir as well. So resilience was something that comes to mind. But I think what I learned most in Belfast was, and that happened literally within the first week of me attending the dental school there, was my perception of learning changed. What I mean by that, back home, there is a very hierarchical system. And suddenly I realized the relationship between the teacher and the student was completely
It's different.
different. The barriers came down.
Mhm.
And suddenly, when you have that sort of environment where there are no barriers between a teacher and a student, the learning environment becomes completely different, enriching, very nourishing. And that's what a kind of, I try my best to emulate that since then, because I've experienced both a hierarchical system where you got to be very careful what you say
What do you
to the
say? Yeah.
teacher, yeah, and a system where nothing is too stupid,
Mhm.
because then you can
You can
express
learn. Yeah.
yourself. You open up. There are no boundaries to learning, and I think that's a wonderful environment to learn in. Dubai was a when I went to Dubai, I thought, this is it. I've done
You're
enough.
going to stay there.
I got more than I had bargained for in the UK,
Mhm.
and then very quickly I realized, this is not me. This is not where I want my life to be. This is not where I want my career to be. But what it did give me was time to reflect, which is quite important in life, and time to focus on what I really wanted to do. I kind of missed those complex, multidisciplinary kind of patients. I missed that interaction amongst colleagues and experts in the field. So that's when I sort of said, no, I've got to go back. And that was like being on the crossroads. It was a time when I had to take, either carry on that route and regret maybe 10, 15 years later, or take a really risky decision and decide to go back. And I'm really glad I did that, because I don't think I could have had a more fulfilling career, professional career, and personal life if I hadn't done that. So it was certainly a moment which allowed me to see things clearly. And then I came back to UK and entered into the formal training in Newcastle. And then the big pivotal moment for me was my when I took my position in London, and I've been there now since 21 years, and it's opened up different avenues, different doors, and I couldn't be happier.
Very beautiful and strong story. Also, this experience of seeing different ways to teach and also having the chance to do mistakes versus a very hierarchical system
Yeah, yeah.
that probably is handicapping learning quite a bit. How about the differences in dental treatment that you were seeing? So you were at university in India, then you came to Europe, then Dubai. Was there any moment where you really said, okay, now I see dentistry different?
I think again, I would sort of say this was primarily, being in restorative dentistry. When you start looking at dentistry beyond being a procedure, you're right. It's not just the procedures that we carry out, but
Mhm.
it's the holistic approach,
Mhm.
and the changes we can make to patients' lives is what really makes
What
dentistry,
drives
what
everything?
drives everything. So that was the pivotal moment. I mean, dentistry, when I qualified way back in 1992, dentistry in India was very different at that time. We got a lot of experience, hands-on
Mhm.
experience. The theoretical knowledge was there, and we used to read American textbooks and stuff. So when I came to Belfast, my theoretical knowledge was
At a good
solid,
level, yeah.
yeah. But there was a lot of the stuff that I had read in the books, but hadn't really seen it.
So
And
because there was no access to those kind of treatments,
exactly,
or
right?
yeah.
And coming to Belfast was the opposite. I immediately sort of started seeing all those things, all those procedures, all those techniques, all those materials, instruments and stuff. But on the other hand, the fellow students there, they were amazed at the theoretical knowledge I had. So it was like I
It
brought
was
the
a good combination.
It
So.
was a great combination.
Okay.
I brought the theoretical knowledge with less of the clinical exposure, whereas they had the clinical exposure, but were weaker on the theoretical knowledge. It was interesting. It was really fascinating. And I think the other thing that really changed in terms of when you sort of saying, if I focus very specifically on implant dentistry, one of the key moments in my own career, which I always sort of say was the watershed moment in how I have practiced implant dentistry since, was before I finished my training, before joining London, I came to Bern for a month, and in 2005, and you know, implant dentistry was still kind of, particularly implant dentistry and aesthetic zone and stuff was a lot of the stuff we were doing it without realizing what the consequences really are and why things are happening. There was very little understanding at that time. And spending a month at Bern, particularly with Professor Boozer and Professor von Arx, was when I actually experienced the tissue level implant for the first time. And up until that stage, my training was around the bone level design implants, particularly the Brånemark implants and stuff. So tissue level implant for us in the hospital system in the UK was a very distant implant, and it was always looked at. But having a very, very different concept, wasn't it? Spending that month with Danny changed a lot. Understanding of really nuances of implant dentistry, and learning the GBR from the best, and working with him and Tom was just a pivotal moment in my career, because that really triggered that complete change in my approach to implant dentistry. So I always tell Danny, I said, Danny, I owe you a lot, because that very brief encounter had a massive impact on my whole career and how I have progressed in implant dentistry. The funny thing is that when I went back to London and started my post there, and I had to make a choice within a department which is already functioning in terms of the selection of implant system that I would use. So to cut the long story short, I was kind of left with very few choices, and then Straumann propped up in that choice as well. I said, I'm happy with that. And they were kind of looking at me thinking, what's wrong with this guy? I said, listen, absolutely fine with Straumann. That's what we're going to go with, because I was brought in to set up the postgraduate program. And 2005, you only had tissue level implant. Yeah. So I was quite happy.
It was another 2 years before the bone level came in.
2006, I got the limited market release on the bone level and stuff. So I started my journey with tissue level, and soon after that, the world started to move away from tissue level into bone level. So I was then fighting against the tide, because I haven't left tissue level. I still place tissue level in aesthetic zone, and we've always done. I mean, I did a little bit of dipping my fingers and toes back into bone level design, and then I looked back at my cases. I thought, hang on a second, we're getting much better results with our tissue level. Why am I moving back to bone level? So the last 20 years has more or less been, I've kind of at times have felt isolated, because I felt like I'm going against the grain. And to convince my own colleagues at that time that this is the way forwards,
was very difficult, I
it's
guess.
difficult. And you have to prove yourself, especially when you're in a new place. You have to prove yourself. You have to prove the effectiveness. You have to sort of demonstrate why it's making a difference for them to then be able to sort of say, yeah, we're with you. And I'm proud that we never changed. And it's interesting now we're kind of going through the next cycle of
Exactly.
generation 4, and everybody is now starting to talk about tissue level because we're now seeing long-term implications. So yeah, that was a big defining moment.
Very interesting to also see, how these waves and decades, they sometimes, there is like a pendulum that
Yes.
maybe with acquiring new knowledge, then you also understand better, concepts. And I mean, what fascinates me also in with your career is that you acquired a very broad set of knowledge. So if you look at very successful clinicians over time, they often start to specialize in one particular area and going very deep. You choose a different route somehow. And so you're a restorative dentist, you're an implantologist, you're a periodontal, let's say, trained surgeon. So you are in endodontics, you're very digital. Why did you actually choose this integration versus a more, let's say, focus on a specific, let's say, work in dentistry?
Yeah. I mean, UK system is quite unique in that sense. So, in fact, when I went to UK, I did a master's program, and um, I didn't realize that there was something called as restorative dentistry
Hmm.
because, like the rest of the world, I was into there's a perio, there's pros, all those what we
Hmm.
call the mono specialties in the
Hmm.
UK. But UK is very unique that there are those individual programs, but then there is a 5-year training program, which is an integrated program,
Hmm.
restorative dentistry, which brings perio and pros and endo under
All
one
together.
umbrella. It's about really, rather than small pieces of puzzle, and that is the perio, the pros, and the endo. It
You
really
look at it
brings the
holistically.
larger picture
Yeah.
holistically together and paints a bigger picture. And that breadth, you know, how often do you actually see patients who come in boxed in a specialty?
Exactly. Yeah.
Yeah, it's very
Yeah.
rarely. So the oversight, I think, that the restorative as a specialty gives you, and this is quite a trend these days. I meet a lot of colleagues around the world who try to specialize in two, who try to do prosthodontics and perio or prosthodontics and oral surgery, and I think that probably is driven also by implant dentistry, made it bit more desirable because you need the knowledge of both. So it was very much a UK driven thing, and with the more complex the case gets, the more integrated the care needs
You
to
need
be.
to think integrated anyhow,
Yeah.
so otherwise you cannot solve it.
So, and as a restorative dentist in the UK, most of the work that we do is around very complex cases. It's people with hypodontia, anodontia, head and neck cancer, advanced tooth wear, and so those advanced, big dental with traumas and stuff. And these sort of patients you cannot treat in isolation. They need to have the broader overview. Now, and it probably from a health economic point of view, if you look at it from a health economics, and maybe that was the main driver in the UK at that time for the National Health Service, you're getting 3 for 1 in here. Yeah.
Okay.
Rather than having to recruit or
Yeah.
employ three
Three different
different specialists,
specialties.
you just extend the training program for 3 to 5, and you just have one person who will give you the dovetail the periopros and endo into it. But yeah, it's very much very broad, very holistic, and it fits in quite nicely with particularly with implant dentistry. And as implant dentistry became more and more mainstream, I never look at implant dentistry as
Isolated.
isolated.
Yeah.
It essentially is one of the modes of replacing teeth,
Mhm.
and one of the modes of providing that the function, the aesthetics, the smile for the patient. Not every patient is the right patient for implants.
Mhm. Let let's stay with this patient perspective for a second, because what I think is very important to understand that the patient, as you said, doesn't look at the treatment compartmentalized in different specialities. So the patient actually wants, the final result and hopes to go through this sequence of steps, in a good way, and then actually is looking forward to to re-socialize, to have the smile that they wish for. Now, on the contrary, so in many medical fields, because of the complexity, we start to specialize and we start to have specialists for smaller and smaller segments of a full treatment chain. Now, you somehow are able to provide a much more holistic, let's say, treatment to patients, probably also in your clinic, because you can, go through the different specialties, do a lot of things yourself, implants as well as the restorative part, if there is, let's say, endodontics needed. So when you look at this difference, your broad training, what does it help to see where maybe a more isolated system or group of people would miss?
I think more important than the execution of treatment is the judgment bit, the the assessment and the diagnosis bit, and then being able to put together the prognosis from each aspect to drive and come to that final conclusion for what is right for this patient. And I think that is a bigger thing.
Yeah.
Then the execution comes later on. You've got to get the diagnosis right and have a treatment plan right before you come to execute the treatment. Often what happens is, as you sort of said, we get more and more specialized in a certain field. So your identification of the problem is often correct, and you can deliver and optimize the bit of the treatment that you're good at, but you may destabilize something else along the way. Does that make sense?
Yeah, it makes sense. So
Because things, one tooth can have three different elements of diseases or problems. It can have an endodontic problem, it can have a periodontal problem, it can have a prosthodontic problem. How does one separate the three?
it's still the same tooth.
It's still the same tooth.
Yeah.
Yeah. Patient, and more complex the problem becomes, more joined up these things need to be. So the broader restorative view, having the surgical or the periodontal and the prosthodontic knowledge really helps you evaluate in terms of what is right for this patient rather than what is right for this tooth often.
So where do you see in today's dentistry, maybe with the different system than the UK has today, also a breakdown of this chain of, let's say, take the right decision for, let's say, that patient? Where does it most often happen?
So first of all, if you don't have the sort of same system as we have in the UK, or if you're not dually trained, then you need the right team. And in that team, you need those components. You need an endodontic input, you need a periodontal input, and a prosthodontic input. So once you're working in a interdisciplinary team, then the most important thing is the trust between the individuals, trust in their judgment and trust in their skill set. And if that trust is not there, then things don't
Things
work
go
out.
wrong. Yeah.
Right. I work very closely with, because I deal with kids and patients with congenitally missing teeth. So I work very closely with, I run a clinic every month, full day clinic with my orthodontic and pediatric dental colleagues. So we do a multidisciplinary clinic every month. We have, in fact, 4 in a month, and we see kids from the age of 9, 10, 11, and we plan them together and they go through their treatment journey, and then I pick them up later on in life when we need to restore them. So but what is the most fundamental thing in my team with my orthodontic and pediatric colleagues is trust, that I know that if we agree on something, hey, this is what should be the right. And we have some unbelievably, you should come someday. The clinic is my most favorite clinic because the discussions we have amongst the trainees and the team is just fascinating. And one thing that I've learned, I always tell my trainees, there is no textbook that's going to teach you what you're going to learn at this clinic, because there isn't a textbook sometimes how to deal with those clinical situations. I said, what you need to be thinking about is out-of-box thinking. Yeah. Come up with some ridiculous ideas which you think, but then drop it in the team and see.
And let's discuss it. Yeah.
Let's see whether orthodontically that is possible. And I always tell my trainees, they sometimes get a little bit ahead of themselves, say, oh, but we can't do this because the orthodontist won't be able to move this tooth here. I said, well, are you the orthodontist? I
So
said, no. I
let's the
said,
orthodontist
no.
to decide for
I
this. Yeah.
said, you make your wish.
Mm.
You think what is best for you from a
Mm.
prosthetic restorative point of view, and then let's put this question to the orthodontist, because that's how a team should work, and you build on each other's strengths. So if the
Excellent. Yeah.
trust isn't there,
Then it doesn't work. Yeah. Yeah.
if the competence and you can't trust their ability and skill to deliver that,
Mm.
then of course
Then it
that
will
breaks
break
down.
down. Yeah.
Yeah.
Perfect segue to, let's say, this next part of our discussion. It's about clinical judgment in complex oral rehabilitation cases. So you're not only working in clinics, university, and hospital, but are also doing a lot of research. And with this, you acquired a lot of knowledge on biological principles. I mean, fascinating studies on cell tissue interaction with surfaces, immune reactions. And if you combine all of this, I believe that you can really do magic in some of the patients. But there might also be a big gap between what could be done and what you might, in an ideal case, want to pursue as a treatment versus what's right for that specific patient. And a specific patient comes with a unique bag of maybe historical things, be it disease, be it comorbidities, but also financial means, what can be done. So how do you navigate this tension between you knowing basically what could be done, but then also really putting the patient in the center and doing what's right for the patient?
This is probably the most difficult thing to navigate, and um, restrain is
Restrain
not easy.
yourself.
Yeah.
Yeah.
Look, we're trained as clinicians, we're trained to intervene, and that's kind of a subconscious thing. Um, Knowing when not to treat is the biggest fundamental, biggest courageous thing in judgment in clinical dentistry, is to know I can do it,
But
it's
I
possible to
will
do
not
it,
do it.
but it's not the right thing for this
Yeah.
patient. And that takes experience, but you also need to be prepared to say no.
Mm.
Modern dentistry, we can do anything. Yeah, a patient comes in and says, "Oh, I need an implant, but I've been told I don't have bone." I said, listen, building bone is not a problem today. We can build bone anywhere as much as we want.
Mhm.
The question isn't about can we build bone. The question is about, are you the right patient for that? And you already outlined all these things, whether it's the finances, whether it's the patient risk, and all those little factors that come into play. And yeah, you're right. Patients, they come in with problems. They have a lot of baggage with them. They don't necessarily come with just the dental problems. There
Exactly.
is, these. Unfortunately, um, I get to see a lot of failures. So, and that's what happens as implant dentistry became mainstream and more dentists start to place implants. I don't get a referral for a simple, hey, here's a missing molar, can you place an implant? Those days are gone.
Mhm.
They more than 10 years
Someone
ago
else will do
stopped.
that. Yeah.
Now what I get is aesthetic failures, multiple implant failures, dentistry done in medical tourism, dental tourism, and those sort of cases. And these are challenging situations because patients have already sometimes even lost trust in dentists and dentistry, and they've had failures, they've had disappointment, they haven't smiled sometimes for years, they've been in pain. So as they sort of say, trust is often the first restoration you need to give
Mhm.
back to the patient. You need to rebuild that trust with those patients. So knowing when to say no and knowing when it's not the right, even though you
You could
you
do it.
could do
Yeah.
it. Yeah. Yes, you can place an implant, but knowing that maybe not, if not no, but at least not yet,
Not right now.
not
Yeah.
right now.
Yeah.
And that's the difficult bit. And to teach that to the younger clinicians and younger generation is an important task that is our responsibility to some extent, is to teach them that, because it's fast paced life now. Like you said, everything is moving fast, 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 fast,
And
fast.
how do you do it? Because there is such a inclination to action. Now you're trained, so I can just imagine, a young clinician sees a patient and actually he or she would know what to do because there was the training. but now, you need to restrain yourself. How do you teach this? Because it also takes a lot of, I would say, confidence to say, well, yes, I maybe could do it, but no, this is not the right patient. And I'm not, you know, maybe I'm disappointing the patient.
Yeah.
And how do I deal with that?
When I'm teaching in the hospital environment, I would always I'd sort of try and instill curiosity in my trainees. And if they can't see it, I'll probe more questions, and I'll try to make them think about the consequences and the complications. Because if they can see that, then they can step back. Often I sort of say, take a step back and just look at the bigger picture. Don't just think short term, think longer term. Think of the consequences. Think, what if? Yeah. Because the digital tools, every case we do is digitally planning and stuff. Planning, we may have the tools, but if you don't know how to plan, and if you don't know what you're planning for,
Then it's
everything fails. Yeah?
it's a bad plan. Yeah.
It's a bad plan, exactly. So really, giving space to the young trainees, giving them space and making them think, and then helping them, connect the dots. And then gradually that, luckily we have them over a 5-year period. So 5 years is a long enough period to kind of...
You can train that muscle.
Exactly,
Yeah.
exactly. And that is what is fascinating, is really, and, as I said, to see them over the period of a few years, and, if they can perform then a plan, a case, and deliver that procedure, which they couldn't have done a year ago or 2 years ago. That's kind of all of a sudden you
that they're
feel...
doing.
One feels fulfilled. We're getting somewhere here, and me as a trainer is like, okay, we're on the right path. We're moving in the right direction.
They're on a good way to actually then decide for themselves.
Yeah.
So a lot of these procedures are elective, and how much of the work that you have to do with the patient is actually less of a medical work, but maybe more of a psychological work, that actually, to bring across those kind of discussions, maybe that's, you came to me with a certain expectation of what to be doing with my smile. But I have to tell you, it's maybe not the right thing for you. It's not let's say a typical discussion that you will have on a knee or hip implant, but probably much more in dentistry.
Again, a very difficult decision, right? Because often patients come in, and a lot of the times patients who come to me have already been to few places. So they're either very confused, or they're already set in their mind what they think they need.
Social media, I saw this picture,
exactly,
this is how I want to look like.
Exactly, and I've been to this dentist, he said I can do it in 24 hours, everything. And it's then breaking that down, trying to understand in terms of what the patient wants and what the patient needs. And then if they're all aligned, it's easy. But if it's not aligned, then you need to break it down for the patient in terms of, because patients will never remember the conversations. When things go wrong, they don't remember the conversations
that you actually told
had.
them that that's a risk.
Right, that's a risk, exactly. So, and more complicated the case, more complicated and complex these conversations really become. And it's being able to sometimes say, no, let us, take it easy, or let us do it a different way because of this. And, my approach is A, and these are the benefits and these are the risks. The psychological element of it, I think it is completely underestimated in terms of, one, it's not taught in textbooks. It's not nowhere in the curriculums and stuff, really. Not enough of it, where we talk about, especially patients who had lots of disappointments and failures. Often the most important thing, the first thing that they need is a listening ear, more than jumping in the chair. So in my practice, my consultation starts
on a table
outside the dental chair.
Yeah.
So we sit, and that breaks the ice. So just listen to the patients, and that is important. So they're not being rushed, and we're not feeling rushed. The worst thing I see often is, sometimes patients are having their CBCTs before they've seen the dentist, and you think, why would you do that? Yeah, without even fully understanding what the patient needs, what the problems really are. So, and because we can change, really transform lives of patients, and in the same vein, we can make it miserable for them as well. And we see this all the time. We see patients who had miserable outcomes because things have been rushed. Um, you know, you can't fly into one country and have treatment done in 24 hours, full arch reconstructions, and expect it to be successful. Not all of them, at least.
Yeah.
Because, the success isn't about how well the things look. Success is, a lot of it is what the patient has experienced along the way as well. Because, at the end of the day, especially with reconstructions and stuff, not only do you need to deliver the result, but that patient needs to have felt that that experience was pleasant. I treat very young patients. We place implants in patients with endodontia. There's never been anything more fulfilling for me seeing an 11-year-old kid who has no teeth and having full arch reconstruction in the mandible at the age of 11. Now, imagine a child. Top dentures is possible. I've made dentures from the age of 6, 7 for patients where we had to change dentures every year because they're growing and it won't fit. Now, the quality of life, these are the kids who, get bullied at school. They are a social recluse. They know they're different than their colleagues and peers and friends. And has a massive impact on their life.
On the development.
On their development.
On their chances in life.
And, putting just 4 implants in the mandible, giving them a fixed prosthesis, and see their life transform, there's nothing more gratifying and fulfilling.
I can imagine.
And that's the sort of impact that we can really have on our patients when we do things correctly. And you can sort of say, well, the choice of placing implants at 11, well, yes, in the mandible, that's what I would do. There's no point in making them suffer when
for another 6 years or so. Yeah.
Doesn't make any difference. Yeah. In maxilla, different story.
Yeah.
In mandible, we go at the moment, 11, 12 in endodontia, I'll place implants.
Fascinating. Yeah.
And their quality of life, they transform after that because their worry is gone.
I can imagine. Wow. Now let's shift perspective a bit, because it's also difficult for young clinicians to actually understand, not only for patients what they can expect. When we go to these conferences and then see these perfect presentations, a patient with severe complications comes in, and then there's a digital planning, there's implant placement, immediate temporization, and then the final restoration. And for the layman, you can't even see whether this implant is now an implant or it's a natural teeth. That also must be quite attractive and fascinating for young clinicians. But in your view, what's the biggest misconception that we're probably having in younger, less trained clinicians when they see those kind of presentations and believe, okay, wow, this is everything that can be done?
I mean, you go to congresses and stuff, and it must be very difficult being a young clinician today, because the temptation, temptation of not just going to congresses. They don't need to go to congresses to see this. They just need to open their phone and get onto one of those social media platforms and see exactly, right? So to restrain from that, and then to have the insight is just so crucial. And the biggest misconception is that it is easy, that the digital tools are there, they're going to do the planning for me, and all I got to do is come in and drill for the screw, without realizing that things don't always go to plan. And if you don't know how to manage the complication intraoperatively, you're snookered. If you don't know when to abort a procedure because it's going to cause more harm than any good, you're snookered. So it's the temptation. That's the problem. And there is plenty of that today. The speed, the photography, and sometimes people, the youngsters particularly, don't realize if Professor Boozer or Professor Zucchelli or Professor Urban is presenting their really complex stuff, and the young brain often forgets That has taken decades of training,
Decades to get there, to be able
right?
to do this. Yeah.
To go on a course for 3 days, 4 days, and go to Hungary, Budapest, and think that a Monday morning they can do that procedure, and that's the problem, is the lack of insight sometimes, and that's the worry. And how do we show all of this to the youngsters to inspire them to pursue more training rather than here's the stuff you can do this on Monday morning. That's the danger.
And that's probably also a temptation that is not easy to teach. Don't fall short, because I mean, if you look at those cases, and if you're talking about clinical judgment, there's so many steps in between and so many decisions in between that you have to take until you get to this final result, that you really need to understand step by step what is now the next let's say decision that I can take. And if I take this decision in that direction, if I place this implant in this position, what does it mean for the prosthodontic work, etc. So I believe it's, as you say, it's a piece of art that needs probably decades to develop.
You're right. And the experience is important. The only problem is that if you don't get the right experience, you're really reinforcing errors. I often meet people who sort of say they've placed thousands of implants, but if every implant is going in the wrong place, then that experience is worth nothing.
Exactly.
Yeah, and I play a lot of golf, and to this day, it has taught me a lot of humility. It's it really does.
Sports can do this, exactly.
Oh my God, yeah. I mean, golf is everything has to be so precise. Very similar to implant dentistry. If your putt is a millimeter off, it's not going to go in. So and it's like you look at. You look at the hazards in golf and think, you know what, I can
do that.
I can do that. Yeah, and you go for it and you end up in the hazard, and knowing when to take the aggressive line and when to go for percentage play
line,
is critical thinking. Is crucial. Is critical thinking, right? And similar in treatment planning and treatments is you can very much apply everything in sports can be applied in what we do in dentistry or in life. Really is knowing when is the right moment to do something and when is the right moment to not to do something, and to prevent an error, a mistake, a judgment, and to treat and to train clinicians to do that is, that's why I think for the youngsters particularly, seeking knowledge, learning is important. I think this is where the breadth of knowledge becomes important before you go into the depth of knowledge. You got to have breadth before you go deeper into something.
Exactly, yeah. So perfect segue to the last part, where I would like to talk a little bit about the next generation and how to train good judgment in the next generation that is more and more also influenced by digital tools and digital decision support, be it AI or be it all kinds of different possibilities. So you're very active in teaching at university, but also you're active in the ITI. You mentor a lot, and you see, as we discussed before, a lot of young clinicians, and you try to help them actually to get to this next level. And for them, probably it must be quite overwhelming at the moment to still understand, what do I need to decide and where can I rely on certain support systems, AI support systems that tell me, where to place an implant, how to design a crown. Maybe there are even tools to decide whether, is this now a simple, a complex, an advanced case. So what type of young clinicians do we need to train to be ready for, let's say, the next generation, for the next decade?
I mean, look, the digital side of things, it's already quite advanced. And yes, there's more to come, and a lot more to come. I mean, stuff that we probably can't even comprehend yet is yet to come. But it's been there like that. But the conversation we were having earlier, you said, but this shift currently is pretty significant shift. The good thing is that all the youngsters coming in, they're pretty tech savvy. Yeah.
They have grown up with this.
They've grown up, they're born in this, they've grown up with this. So they come with a basic understanding, a baseline knowledge of technology they come with. So teaching them the digital side of things is very easy. Uh, what we need to focus on is how do we build that human judgment in them? So that actually what we need in the long run is, we've got digital tools. Of course, they're going to get more refined. Of course, they're going to get more better. But there needs to be a better integration between the digital and the human judgment, human brain. Because dentistry remains a profession where we're treating patients. I am yet to meet a patient who wants to be treated by just wants to come into a AI robotic clinic and not meet a human being. Yeah, the human touch, the empathy, the conversations, the reassurance, that's only going to come when you sit with a human being. So it's not going to take away that human touch. Clinical procedures, is robots going to take over dentistry? I don't see that happening in a foreseeable future in reality. So where those tools are going to come in is going to help you plan things, is going to help you in execution of treatment, whether it's your guided surgery, whether it's static or dynamic, doesn't really matter. But the us as clinicians are still more or less have to sit in the center of all of this, and the technology has to sit surrounding us. So compared to when I was a student, today's students, they're in this wonderful place where they can really merge the two together. I mean, I started my digital journey back in 2007 with the CEREC 2 and the CEREC 3. And then the first iTero, when it was
came out,
with you guys before it became on it. Yeah, I've kind of literally, we've been pretty digitally advanced from the get-go. So all my trainees, the infrastructure that we have, both from the implant planning point of view, from the lab, from the clinical scanners and stuff. So it's more or less ingrained in our setup. But still, the most important thing, what is going to be needed for future and the coming generations, is how do we instill this human element in it, treat them, teach them how to properly treatment plan. And treatment planning isn't one size fits all. That's the problem,
Exactly.
right?
It's very patient specific.
Tailored, exactly, tailored, customized treatment plan, depending on the person who's sitting in front of you.
And when you look at the young students that you're seeing today, what gives you most optimism? And maybe controversially, what worries you most? Because you said they come already tech savvy. That's probably very positive, but it's still AI is in its infancy and it develops very fast. So we're still learning about where are the limits? Can we trust the system? To which degree? What can be done? What cannot be done? So there must be both. You see quite optimistic, but also some.
I was at a conference last week, British Society of Restorative Dentistry conference, and there was a radiologist who was speaking on the role of AI in imaging today. And it was quite an interesting, fascinating lecture, because she was showing various AI models that are available for diagnosing problems and giving you radiographic reports. I can tell you what is going to happen over the next decade is, I think there's going to end up a lot of overtreatment.
Why is that?
Because AI is picking up things which we saw with human eyes,
but we discarded.
Not discarded, but sort of said, okay, that doesn't need treatment. And what's going to happen with a lot of the younger generation, not necessarily related to generation, but a lot, because dentistry still is a business. Yeah, people still have
what not to do.
It goes what not to do. But there may be a perception that the AI report is now giving me a license to, it's saying, oh, it's got a pathology here. A pathology, we would have sort of said, yeah, it's there, but let's look at it in a year's time. Let's look at the X-ray taken 5 years ago. It still was there. Not everything that we see on an X-ray needs treating. Yeah. Whereas the danger now here is that you're going to start to overtreat patients. Now, at the same time, we also had a speaker from the medical defense union.
That's what I wanted to go at exactly.
Yeah,
So
because
you cannot do nothing if you see something, I guess.
but also you cannot say that, oh, AI told me to do this treatment.
Mm.
Human judgment
Human
is
judgment
important,
yeah.
because ultimately it's going to be the clinician who is still responsible for the decisions that we take. And if you look at all the AI, even the transcribing softwares that we use, there is a disclaimer at the top. This is a transcription from AI. You as a clinician need to confirm this is accurate.
Mm. I mean, there's also the flip side probably. So, if AI detects something and you're not officially stating, okay, I saw it and I don't do anything, maybe later on it could be a legal case. So it's a difficult, delicate balance that,
Completely
that
agree.
we
But
need to
that's
find.
where you rely on the team. That's where I would then, if there is something that I think, I'm not
Not
sure.
sure. Yeah.
I can see there's something, but does it need treating? Well,
Let's discuss in a
there's
group.
something called, as a specialist in radiology, you ask an opinion. You sort of say, right, can you have a look at this X-ray and give me a report? What do you think is the diagnosis here? And then you can make a better judgment. Yeah,
Very interesting perspective.
that's the team. That's the
yeah.
teamwork. That's why we are different specialists. Is you don't know everything, and you need to rely on people who are experts in their field to give you their opinion.
And it also changes our perspective a bit, because what you're basically saying is that AI is not just helping us to make better judgments. It might also create more effort to figure out whether the judgment is accurate. And you need to react to, basically, if you're asking, you need to react to what's coming back in either way. And
Correct.
so this could also not only lead to over treatment, but basically also take additional bandwidth of taking the right decision.
And it will certainly help you identify things that you may not be able to see. Absolutely. So it will work both ways, and that's why we as humans will need to continue to be smart enough to know how best to utilize this tool.
So to extend on this, what type of critical thinking do you need to install, or believe that you need to instill this in your patients to be ready for exactly those conversations that we're just having?
In patients or
No, with young dentists.
young dentists?
Yeah.
I think again, we need to instill curiosity in them. Ask questions. Why? Why are we doing this? Why is this thing happening? What are the consequences of it? And make them believe that you will make mistakes. We'll all make mistakes. As the wise man sort of said, you make mistake, learn from your successes, learn from your mistakes, but don't repeat your mistakes. Because the foolish thing to do is to repeat the mistakes over and over again. And that comes from, and the only way you will know what a mistake is reflection. If you're continuously reflecting, continuously seeking feedback, particularly as when you're young in training, getting feedback, getting critical feedback, and using that critical feedback to build positive things in yourself is important. I mean, it's like again, like golf. Every time I play a great round of golf, I can't wait to go back to play better. And the next time I go there and think, oh my God, that was a bad round, right? I still can't wait to go back because I want to fix that bad round. And it's the same thing, just when we think we know it all, that's the day a mistake happens, and then you immediately that humility comes in.
Needs to set in. Exactly.
And you know what is fascinating, that this humility is pretty. It's one of those things that, in an inadvertent kind of way, if you got the right humility, you're indirectly protecting patients, because you're being less egoistic and you're learning from mistakes. So somebody is benefiting from that. Not only am I, as an individual, as a clinician, but the byproduct is my patients are getting better because I am not repeating mistakes.
The mistakes, yeah. And that's a very beautiful circle to where we started also, with you seeing this difference between this Indian education system versus then, what you had in Europe with a much less hierarchical, let's say, way of teaching, where also these kind of mistakes, they are not mistakes, but learning opportunities.
I have absolutely no problem in telling my trainees when they ask me something, some question, I'll sort of say, I don't know.
Mm.
Let's go find out.
Excellent.
Right? And as a teacher, that takes a lot of courage because
Yeah, because you're the one that needs to know
needs to
everything.
know everything. But to be able to sort of say,
Yeah.
you know what? I don't actually know the answer to
Mm.
that. And in
Yeah,
fact, you can turn it around and sort of say, why don't you go find out and then tell me as well? Because
mhm.
then you're making them learn and then coming back to teach you something as well. And I think that's the lifelong learning
Learning. Yeah.
cycle. Because when you think you know everything, you're in trouble.
It's not a good sign. So maybe to conclude this section also, in your view, what do we need to do, companies like Straumann, when we now how should we develop the future of dentistry in I would say a responsible way, so that actually this difference between what can be done and what should be done is not overstressed in a sense that everything can be done.
I think, I mean, companies have a huge role to play. I mean, you have massive reach, more than universities have, more than the hospitals have, more than clinicians have, global reach, companies like Straumann. So, what do you need to do is to continue to remain responsible. And I know you're doing that, and that's why I'm here.
Mhm.
And, remain responsible. You've the developments, of course, you can't stay stagnant. You've got to keep on developing and stuff, but mind it that, um, the um, to try and instill the fact amongst the clinicians around the world who are your customers
Mhm.
that with everything that you provide there is an onus on education as well, training as well, right? And so that has to come from you both. You have to provide the evidence, research behind things that you are promoting, and you have to provide the education, particularly to clinicians who don't have access to institutional education, shall we say. And that's the vast majority of the clinicians and dentists around the world are the ones in their practices who don't have access except when they go for congresses. And how often can they go for congresses? So huge role for companies like Straumann and others to navigate and safeguard both the clinicians and the patients.
Mhm. Together with institutions like the ITI, where we can actually really do education and help.
I mean, IT has had a huge impact on my career in terms of the growth of ITI over the last 15 years. I think about 27,000 members at the moment worldwide. There isn't any other organization or association in dentistry, let alone implant dentistry, which has such a
Such a
global reach.
reach. Yeah.
So, and IT has been doing wonderful things from developing evidence, consensus statements, and congresses and stuff, and study clubs. I mean, I run a study club
Hmm. I know.
um, in my golf club, and often in the summers we play golf. We mix,
Yeah.
we play golf in the afternoon and study club in the evening. And two of my study clubs are always case discussion. And I asked my study club members. They bring cases in, and we have often been in our study club till midnight. Would you believe it?
Yeah, because it's passionate. So
It is.
people are
I
passionate
mean,
about
I love
those
those
cases. Yeah.
evenings, not the lecture evenings. The study club when we're
Mm.
discussing case till midnight,
Mm.
and nobody wants to leave because it's just such a healthy learning environment. We're bouncing, bringing cases, learning from each other, discussing things, and then because these cases are relevant because somebody's brought a case that they want to treat. They can treat it, but they just want to reassurance.
Is it the right
Is it the
approach that
right?
I'm choosing? Yeah.
Exactly. So at the grassroots level, which is what I class the study clubs to be, if they run properly, they can have a massive impact in that little community
Mm.
where you can protect and shield each other.
Excellent. That brings us almost to the end, Shakeel. Thanks a lot already for a very fruitful and interesting discussion. So I would like to end the conversation with maybe just 3 takeaways from your end. So what would be, the one piece of advice you would give to young clinicians that want to venture more into complex cases?
I would say patience, right? Take it easy. Um, Seek knowledge, seek experience, build your experience because complex cases is something that requires layers of experience and it requires patience, right? Um, I grew up fly fishing in Kashmir. You know, an experienced angler won't just come in and wade into the water and start fishing. You come in, you spend the first 5, 10 minutes early morning before the sun is even up
Just
to
observing.
just to observe, just
Mm.
to see which way the water is flowing, where are the fish, where do you see fish jumping and stuff? What sort of fly to use depends on what sort of insects are flying around and stuff before you start to cast. So step back
Mm,
sometimes.
be patient.
Be patient. I think
Excellent.
that was the advice I would give
Yeah.
youngsters, especially in today's day and age, where speed is everything. And same advice goes to Straumann: immediacy, immediacy, immediacy.
Mm.
Let's just sometimes say immediacy when it is right,
Mhm.
not immediacy for everything.
Excellent. So, what would be then your piece of advice for experienced clinicians? So, what is the one thing they should stay humble about? We discussed about it before.
It's staying humble. That's it.
Staying humble. So that's already it. Yeah.
Yeah, I think
Mm.
staying humble and knowing that every day is going to teach you something new. And, just when you think you mastered it all, something is waiting, surprise is waiting. So I would sort of say, I think reviewing long term and looking at your patients after 5, 10, 15 years is what really teaches you whether what you did back then is successful. Because dentistry is not about short-term fixes and stuff. Even though, implant dentistry looks immediate, but really what we want is to play the long game.
Mhm.
And the most I've learned in my own career is through clinical photography.
Mhm.
I I take pictures and photographs of everything I do in my clinics,
And you then can go back
and
and learn.
this has
Yeah.
taught me a lot, George.
Yeah.
Unbelievable amounts. There is
That
no amounts of
mm,
note taking and writing
that will
which you can
substitute for the
capture.
picture.
A
Yeah.
picture 10 years later, you can compare the two, and it's just like a radiograph. Having a clinical picture will give you so much
Mm.
insight into your own
Yeah.
interventions and consequences of that.
Excellent advice. And then, lastly, so is there one principle in dentistry that we should never give up, even if it becomes more and more digital and we have more and more fancy toys that maybe substitute for one or the other decision that we have to make?
I would say I don't think what you started on is the human judgment. And that principle, you just can't break away from that. No matter how digital, no matter how automated dentistry is going to become, it will always be dependent on us making the right decision and then asking our tools to help us deliver that decision. Does that make
Excellent.
sense?
That makes absolute sense.
It
Yeah.
has to be a human
Yeah.
decision, has to be the pivotal thing that we do. And that is then going to, the tools are there to use, the digital tools and stuff should augment wisdom, not replace it.
Mhm. Excellent final word. Thanks a lot, Shakeel, for a very, I would say, inspiring and conversation full of learning bits and pieces. So I really enjoyed it. Thanks a lot for joining us.
Absolute pleasure, George. Thank you very much. I really enjoyed it as well. Fascinating talk.
So
Thank you.
thanks a lot, Shakeel. To our audience, thanks a lot for actually listening to us. I hope that you actually enjoyed this talk with Professor Shakeel Shahdad. And if you found some nuggets that you were interested in, that you would like to actually use in your daily practice, please also share this episode, because there might be also others that would be interested in this type of wisdom. Watch out for the next episodes. We're of course going to continue this series. So stay curious, and we catch you in the next one. Thank you.